Today we will discuss why jaundice occurs in newborn. Here we will find out how common is jaundice in newborn babies, why newborns are prone to jaundice more than adults, which babies are prone to high jaundice and bilirubin encephalopathy, story behind jaundice and icterus. Are jaundice and icterus same or different? At what serum bilirubin level jaundice becomes apparent in adult versus in newborn? Basic difference between adult jaundice versus neonatal jaundice. So let's get started. Story behind jaundice and icterus goes like this. The word jaundice originates from a French word jaune, which means yellow. Jaundice basically means yellow skin. The word icterus arises from a Greek term icteros, which signifies a specific type of yellow bird. Greeks believed that jaundice will subside if a person with jaundice gazes at that particular type of yellow bird. Are jaundice and icterus same or different? What is jaundice? It is a condition in which skin or mucosa or white of eye turns yellow due to deposition of bile pigment or bilirubin from blood. Often word jaundice and icterus are used interchangeably. However, some use the term icterus to define just scleral icterus, that is yellow discoloration of sclera of eye. At what serum bilirubin level jaundice becomes apparent? Normal total serum bilirubin level is 0.2 to 1.3 mg per deciliter. Jaundice is clinically noticeable when serum bilirubin increases to certain level. It is apparent in adult sclera if serum bilirubin is more than 3 mg per deciliter. It is visible in newborn sclera if bilirubin is more than 2 mg per deciliter and newborn skin if it is more than 5 mg per deciliter. Jaundice in adult versus neonate. If an adult develops jaundice, then almost always there is an underlying disease or pathological conditions. But for a newborn baby, it is not the same. Even a completely normal newborn develops jaundice quite frequently. Though pathological jaundice can exist in a baby, oftentimes jaundice is a part of normal newborn physiology and does not necessarily indicate any pathological condition or disease. This type of jaundice is called physiological jaundice. We will discuss difference between pathological and physiological jaundice in a separate video named What Causes Jaundice in Newborn? How common is jaundice in newborn babies? You will be surprised to know that about 80 to 85% of term babies, that is babies delivered on time, and most preterm babies develop jaundice few days after delivery. In today's video, we will find out why do newborns in general are so much more prone for jaundice than adults. What could be possible reasons? Primarily, there are three most likely reasons. First, RBC breakdown. Second, immaturity of liver. Third, increased enterohepatic circulation. Why newborns are more prone for jaundice than adults? First reason is increased RBC breakdown. Bilirubin is a byproduct of RBC breakdown. More is breakdown of RBCs, more bilirubin is produced in body. That happens because of two reasons. First, more red cell mass. Apparently, newborns have more red cell number or red cell mass compared to adults. Newborn hemoglobin is between 14 to 24 gram per deciliter compared to adult, which is 12 to 18 gram per deciliter. Second reason is shorter RBC lifespan. In term baby, RBC lifespan is 60 to 90 days, that is 2 to 3 months. In preterm baby, it is 35 to 50 days, that is 1 to 1.5 month. As against adults, where it is 120 days, that is around 4 months. As RBC turnover is more, bilirubin load is more as well in newborns. Fun fact, bilirubin is a breakdown product of hemoglobin. From 1 gram breakdown of hemoglobin, approximately 34 mg of bilirubin is produced. Data says in an adult, per day production of bilirubin is approximately 3 to 4 mg per kg per day, whereas in newborns it is significantly more, that is 6 to 10 mg per kg per day, which is almost double. Why newborns are more prone for jaundice? Second reason is immaturity of liver in newborn. When baby is in utero, bilirubin is produced in fetus is cleared by placenta from fetal into maternal circulation, which is then cleared by maternal liver. But once the little one comes out of womb, it is dependent solely on its own liver to clear all bilirubin produced in its body. However, a newborn's liver is not mature enough to clear bilirubin load. This is due to two reasons. First, decreased ligandin level in hepatocytes to uptake bilirubin. Second, decreased UGT1A1 enzyme activity in liver. Fun fact, in a term baby of day 7 of life, UGT, that is UDP glucuronidase transferase activity, is approximately 1% of that of adult. And gradually, this enzyme activity increases and reaches adult level by 3 months of age. Why newborns are more prone for jaundice? Third reason is increased enterohepatic circulation of bilirubin. Babies have increase in enterohepatic circulation, which happens due to following reasons. First, high intestinal beta-glucuronidase in newborn. Second, decreased intestinal bacterial flora. Third, decrease in motility of gut. All of these above causes more conjugated bilirubin to deconjugate in gut, and again bilirubin enters into circulation. Which babies are more likely to get high jaundice and kernicterus, that is bilirubin entering and affecting brain? A preterm or premature baby, that is a baby delivered before 37 weeks of gestation, has even more RBC turnover, more immature liver, and increase in enterohepatic circulation, predisposing it to even more jaundice, that is high bilirubin. Furthermore, preterms are more likely to get kernicterus, that is bilirubin encephalopathy, that is bilirubin affective brain at lower bilirubin level compared to term baby. Threshold for preterm to tolerate bilirubin is low. To sum up, though jaundice is a pretty common phenomenon in most newborns, parents or caregivers and physicians need to be cautious and watchful for icterus, especially for preterm babies who are more so on risk. Quiz time. Today's MCQ. Often jaundice in newborn occurs without any underlying disease. True or false? Write your answer in comment box below. Thank you for watching the video. Hit the like button if you like this video, share this video with your friends, and do subscribe to Paediatrics Simplified. Disclaimer: this video is for educational purpose only. For medical advice, kindly consult your physician.